Good morning, everybody. Welcome to the Children and Adults Health Wellbeing Policy Development Scrutiny Panel. I'll be chairing today in the absence of Councillor Vic Pritchard. I'd just like to, we're going to just to say that we're going to have a bit of a change around possibly with the agenda today because Councillor Romero is at another event and so is running a little bit late. So I will bring her in when she gets here. So Mary, if you're happy to come in a bit sooner than you were expecting to, then that would be great. I'd just like to ask Mark to go on with the emergency evacuation procedure.
Great, thank you, Chair. Yes, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area just outside Brown's Restaurant. There's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated a safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you, Mark. And do we have any apologies for absence or any substitutions?
So, yes, currently, Chair, apologies from Councillors Pritchard, Joanna Wright. Councillor Appleyard is also at the same event as Councillor Romero, so they're both due to join us later. And one of our cooperative members, Kevin Burnett, can't be here today.
Thank you, Mark. And are there any declarations of interest?
Yes, Chair.
Thank you. There's no urgent business agreed by the Chair, so we can tick off item 5, and we don't have any councillor statements or statements from the members of the public. No. So can we go on with item number 7, which is the minutes from the 7th of June? Does anyone have any comments? No? Are we happy to sign them off as an accurate record of the meeting? Andy, thank you, Councillor Waite, and thank you, Councillor May. That was quick. Okay, so as our Cabinet member isn't here yet, we'll skip over item number 8. And can we come to item number 9 again? Dr. Brinbird is no longer in his post at the CCG. So we are now waiting for his replacement for the ICA Place Director to be appointed. So when they're in post, they'll be hopefully coming to the meetings. Is that correct, Mark?
Yes.
Yeah. So
you have been given an update. If you do have any questions on that, then forward them to me in due course, and we'll find somebody to answer them on behalf of the panel. Or sorry, for the panel.
I don't think we've got anyone to present the Children's Mental Health Transformation Plan yet, have we?
Not with us yet, Chair.
Okay, that's fine. So, Mary, could we come to you for item number 11, the Children and Young People's Participation Update?
Certainly, Chair. Thank you very much. And again, apologies from Sarah McCluskey, who wasn't able to attend today to present the paper, so I'll do my best to present it on her behalf. So the paper and the related appendices give an overview of the review that has been undertaken by Off the Record, which is our local provider, in relation to the support and delivery around the Member of Youth Parliament in Bath and North East Somerset. Colleagues will know that we have had our representative in a Member of Youth Parliament for many years in Bath and North East Somerset. But over the last 18 months, and with some of the challenges of COVID, the delivery model has changed in the last 18 months. So the proposal that is to scrutiny today is to consider the proposed new delivery model for children and young people's participation in BANES. And attached to the proposal is a report from Off the Record that gives an overview. There's also a report from a youth networking event, all of which have contributed to the thinking around the change in the delivery model. And what the model proposes to do is to widen the participation reach in terms of young people and the various young people's groups across Bath and North East Somerset. And the appendices give an overview around, while it was a democratic process around a young person representing, the feedback from that young person and from off the record is that they felt that they were unable to adequately represent all of children and young people's voices across the area. So the proposal about widening the reach, so there would still be a participation lead within off the record in terms of the contract, but would very much more look at that broader engagement with the whole range of children and young people's groups, and greater partnership working. So there would be an opportunity to bring those groups and those young people together at least once or twice a year, so in terms of a wider networking event. There is a further meeting planned with Councillor Romero and a number of other councillors on July 20th, then to reconsider how young people can influence decision making. So it's not about them not influencing the decision making, but doing it slightly different from the manner we've had previously. Happy to take any questions, Chair, around the proposal. I think the paper gives the detail around the proposal. I guess the other bit I would also say is that the contract value remains the same. The contract remains with off the record in terms of being flexible about responding to the needs of children and young people across Bath and North East Somerset. The Commissioner, who is Sarah McCluskey, fully supports the proposal, and Councillor Romero also supports the proposal. In her absence, Councillor Romero also supports the proposal. Thank you.
Thank you, Mary. Do we have any questions? Councillor Harben.
Hi, Mary. You've received my questions, so I don't. I've been told by the chair I mustn't do a preamble. So if I just cut straight to the chase, I think we'd all support the fact that having a youth member purely as our youth participatory process is almost outdated and there needs to be wider youth participation. So I've had a tiny bit of a preamble there, but I think we'd wholeheartedly support off the record in that. However, I have been involved in these youth elections when I was a teacher, and they were a terrific process for youngsters to get involved in voting, etc. So my first question, it says that they can still support these the UK youth member elections by promoting them through their networks. Are we still able to do this? The second one about the Bath Student Parliament, and it's interesting to see it's right across schools, independent and state, but very much in Bath rather than outside of Bath. So I can see why it started off in Bath, but maybe it would be great to extend it to those of our schools in North East Somerset. And then the last one is the Youth Forum, who's involved. And I recognise that Keynsham has been involved, but in my area, Paulton, and also Radstock and Midsummer Norton, there are youth groups and Whitchurch, excuse me. How could I leave Whitchurch out? There are youth groups which would be great to encourage them to be involved in the Youth Forum. So those three questions, Mary. Thank you.
Thank you. So if I take those through, Councillor Hardman. So in terms of question one, so if any Bath Student Parliament or any schools wanted to be involved in the member of youth democracy in the future, off the record would still be able to support. So there is still that commitment there. And they've got some technology and some links and resources that they could make available to the various schools. So that commitment and capacity is still there within the provision. In terms of question two, I've noted that Sarah McCluskey will follow up directly with off the record in terms of looking at North East Somerset and other areas as opposed to Bath Student Parliament. That is a recent development across the Bath schools. And certainly in relation to the third point around any other youth groups, we would welcome updates on any youth groups that we may not be aware of, and certainly Sarah will be happy to facilitate that support and contact through the youth forums, because the youth forum is meant to be as broad and inclusive moving forward.
Could I just ask one supplementary? It's just, how will the youth groups know that the youth forum is taking place? Will Sarah contact people like, the Youth Connect Southwest, which does a programme for all of us in North East Somerset?
Yeah, and Youth Connect Southwest are fully involved with the Youth Forum, right. But certainly it would be for off the record in terms of promoting the various networking events. But again, we would welcome any input or any other groups that we may not be aware of. Thank you.
Councillor May, you had a question.
Mary, can I just, I originally involved with setting up Off the Record, so I've got a long commitment to it for a long time, and they've done some brilliant work. It's just that the contract is 2015, so we're 7 years into the contract with Off the Record. And I'm aware that we've got a terrific range of voluntary service providers throughout the area, and I'm just wondering whether are we putting all our faith into one organisation? And I know that this forum sort of widened it out into other people, but I just wonder whether are we going to be in any recommissioning stage at some point? And with the proposals that, as they're brought forward, are we going to put a time when we take stock of whether they've actually worked? Because I think one of the difficult things, and it's quite clearly picked up, is that young people, if they get involved with something like this, you know, they've actually got their own lives to live, and it can be quite demanding and quite stressful for them. Thank you.
Yeah. So Councillor May, yes, so to confirm, at some point we will be re-procuring the participation contract. So that is one of the contracts that we must have to ensure that our children in care and our care leavers have the in-care councils. So as part of that wider participation, we will be looking to re-procure, and we would hope that the best provider will get that re-procurement when it comes up. We will obviously specify within that re-procurement the support around the youth forum in terms of that widening participation. Thank you.
Thank you. Councillor Waite.
Thank you, Madam Chair. Yeah, mine's more of a comment actually, rather than a question, because I think most people here know that I am the lead mentor of Keynsham Now, which is the group in Keynsham that sort of does similar work to Off the Record in Bath. And I have noticed in the last year a change of emphasis from Off the Record and the Youth Parliament in Bath. I mean, some of the members of Keynsham Now used to go to the meetings in Bath, and one or two of them had, one in particular I know was the member of Youth Parliament. So it is fair to say, I think, that before this year the contact between the two organisations was very, very slim, although I did try a few times, to be fair. But more recently, we have had quite close contact with Off the Record. They have been to a meeting in Keynsham. Keynsham Now have chosen Off the Record as their charity. So, in fact, on Sunday, they were raising money for Off the Record at the Keynsham Music Festival. So, and also, Keynsham Now members have been invited to your meeting on the 20th of July to meet with Kevin and the various other members of the Cabinet. So I think the reason why I'm speaking is that, one, it's something I know about, which is quite rare, and also that I welcome the change, and I think it's much more helpful to spread it across North East Somerset, and I hope it will get to Midsummer Norton and Radstock and Whitchurch, to ensure that that there is democratic representation, because one of probably my most enthusiastic sort of campaigning issue is getting young people involved in local politics, understanding how local politics works, and hopefully getting rid of the fairly ageing group I see before me here, to actually have younger people representing their communities in Bath and North East Somerset. Thank you.
Thank you.
Councillor Malloy.
Thank you. Yeah, just sort of following on from that, really, I was thinking about, you know, the possibility for the young people to get involved with campaigns and so on, and that made me think again about what type of voting system is generally used in all of these forums and the Youth Parliament. Is it still first past the post, or is it proportional representation of some form? So that, I would say, has a lot to do with getting people, young people in particular here, more engaged in politics, because their voices are more likely to be heard with proportional representation. So I was just going to put in a plug there also for a campaign group called Make Votes Matter. If you'd like to pass that on, thank you. I think it is quite significant, actually. that the voting system, the effect it has on people's interest and willingness to be engaged in politics.
Thank you. Are there any other questions? I'll come back to you in a minute, Paul. I was going to ask actually if it's possible for some of the young people to come and talk to us in this panel at some point, because we used to have, in the panel's previous incarnation, we used to have a member of Youth Parliament come to present to us, and it was always very engaging, and so I think it'd be really good to have them back here to talk to us at some point.
I think they'd be very happy to attend. They generally attend corporate parents in terms of corporate parenting, but I imagine a group of young people would be very pleased to attend and present.
It'd be quite nice to have them to come and talk to full council occasionally, because corporate parenting is sometimes not as well attended as it could be, but if they could come and talk to full council, they've got a captive audience. Sorry, Paul.
Thank you, Chair. I was going to pick up the same point, really, but in a slightly different way. I mean, this committee has observers from the trade unions and religious people. Could we not just have a standing invitation that we have somebody from the Youth Parliament to come along to this meeting? Because I'm sure if you're outside of this meeting, we look a scary bunch, but when you come in, you actually see how democracy is working, and I think there might be some sense in us actually widening our invitation to include somebody. It doesn't have to be the same person all the time, but I think it might be worthwhile for them to perhaps have that opportunity to come along.
I think that's an excellent idea. Councillor Waite.
Yeah, I mean, basically, Cambridgeshire Now works very closely with Cambridgeshire Town Council. Cambridgeshire Now has a standing agenda item on every Cambridgeshire Town Council agenda, and therefore there's a member of Cambridgeshire Now in every Cambridgeshire Town Council meeting. So that's how their voice can be heard. There are there's one current and one ex-Cambridgeshire Now member who are Cambridgeshire Town Councillors at the ages of 25 and 19. And that's the way, I think, possibly for areas outside Bath to actually get local democracy into their communities, is what I would suggest. And I would also like to, through you, Chair, would you like me to invite some members of Cambridgeshire Now to come to a council? The problem we have, I suggest, with your suggestion, is that most of the members of my Cambridgeshire Now are in school. So to come to a meeting at this time of day would not be appropriate, sadly.
Yeah. Is there anything else? Any other questions? Okay, right. So thank you, Mary. I think you're as we are mental health transformation plan people still aren't here, I think we can move on to item number 12, which is the youth justice plan. So Mary, it's you again, star of the show today.
Yes, please. So apologies from Sally Churchard, who was due to present this paper this morning, but unfortunately Sally has come down with COVID. So I will try and speak to her slides because there is a set of slides that gives the overview in relation to the Youth Justice Plan. This is an annual requirement that we take the Youth Justice Plan both through PDS and to full Cabinet in terms of the governance. So you will have a report, it's a 9-page report that gives the overview of the Youth Justice Plan. And what's slightly different this year than in previous years is nationally we have received guidance about the template of the format and the areas to be covered within the Youth Justice Plan. So it looks slightly different than what you may have seen in previous years, and that's the rationale. So if I just take you through the slides. Mark, if you could go on to the next slide, please. Yeah. So the legal basis for the Youth Justice Plan is set out in the Crime and Disorder Act of 1998. And colleagues may be familiar with this slide from before. So that required the statutory partners to set up multi-agency youth offending teams. And for us that includes the council is the lead partner with health, probation and police services. So that act set out a duty to cooperate and to help resource youth justice teams, youth offending teams, I beg your pardon, and with the statutory purpose is to prevent children offending, the requirement to produce an annual justice plan, and that is a requirement to enable the local authority to receive the national grant. So the youth offending team is funded both by probation, health and police. So again, that's just the overview from the Crime and Disorder Act. Mark, if you go on. Thank you. So within the emerging changes within the Crime and Disorder Act, there are 4 key principles, and what I would draw attention to is seeing children as children. So first of all, in terms of our youth justice system, it's about seeing children as children and victims as opposed to perpetrators in the first instance. So again, looking and prioritising the best interests of children, recognising their needs, capabilities, rights and potential. Secondly is to develop a pro-social identity for positive outcomes. So what you see within the principles, seeing children as children, looking at the positive outcomes, working with children in terms of collaboration and their voice, and the promotion of diversion. So again, how do we stop children offending? How do we divert them from offending? And how do we best support them to reduce offending? So in terms of the next slide, Mark, please. So again, within Bath and North East Somerset, our rates of offending and our rates of first-time entrants continue to reduce. So the number of children coming into the justice system overall is at its lowest since 2000. And again, within Bath and North East Somerset, there is a tremendous amount of work done with our police and with the magistrates to look at how children can be supported through out-of-court dispersals and or diverted by police. So again, a lot of work done at a preventative level. Thank you, Mark. So this slide gives a bit of an overview of data. And again, within the youth justice reporting, the data is always a year behind. So it's not as current as some of our social care data because it's dependent on police data. So the latest data is for July 19 to June 20. And again, our rates are still low, 32% lower than all comparators. And for those who did reoffend, the average reoffending rate was 2.88. So that's still too high for us because we don't want children reoffending, but it is lower than our comparators. Mark, if you could do the next one, please. Oh, you've already done it, sorry, apologies. So again, I have 2 sets of glasses, one for short and another for long, so I can't see that. So in terms of our custodial sentencing, again, the numbers are very low in Bath and North East Somerset. In that period, we had no children who received a custodial sentence, which is really, really positive. There is really strong multi-agency work and strong community proposals have enabled court to sentence in the community. So again, the majority of children who have offended are supported through community orders. No custodial remands in the last 12 months, so again, that's really, really positive. And there's been a significant amount of work done around reducing child custodial population. So I guess the statistics give a good overview in terms of how well we're performing locally within Bath and North East Somerset. But we still have challenges which are identified on the next slide in terms of the strategic priorities. There's more work for the youth offending service to do in relation to participation. And we recently, as a YOS management board, had a development day. And one of the areas we decided to change is that for every YOS management board, we will start the meeting with the voice of children and young people. We will start with a case study so that we bring children and young people directly into the room and into the meeting, which is something we're going to look to replicate. So before we do minutes or attendance, we will have a case study about young people to actually hear what it's like for them in terms of their experiences. Within the report itself, there is a reference to the lambing review and the 83 recommendations around the disproportionality of young people for BAME being represented in the youth justice system. So again, there's a significant priority within the priorities moving forward around how that is addressed. Both Black and dual heritage girls, as you'll see in the report, older adolescents, and those with SEND needs. Extend the practice model. So there's been a lot of work done within our local system around enhanced case management and recognising the trauma that all of our children and young people who generally offend have experienced. So again, working with partners and our schools around how we extend that practice model and really promote restorative practices when our young people do offend. Exploitation. So again, our young people are exposed to both criminal as well as wider exploitation. So there's a significant focus around tackling exploitation that's very much discharged through our serious violence strategic group. And again, there's quite a lot of detail in the paper around the work of that group. And then finally, around the workforce. It's been really positive. We've all moved back to the Civic Centre, and I think all of our teams, including our YAWS team, are really pleased to be back with colleagues, be that in Rosemary's team in terms of SEND and our wider children's social care teams. So a lot to do. The other bit in workforce that I would pick out from the paper itself is the work around how do we increase the mix of our workforce to be able to be representative of our young people in terms of a BAME background. So again, in terms of recruitment, working with our HR department about how we can positively work to recruit colleagues from that background. Happy to take any questions on the paper. Thank you.
Hey, I had a lot of questions, well, three pretty meaty questions, and Sally has answered them very thoroughly, so I have nothing more to add. So, but thanks, Sally, for me. Thank you.
Thank you, Councillor Hardman.
Thank you, Chair. Can I just say it's a shame Sally's not here today, and because I think what this shows, this report, it often goes through to full council, and presumably it will after this go to full council. And normally it's just sort of nodded through and nobody takes any real interest. And I think it's really important for society that this system works well. And it's really complicated with different partners and everything. So I think that the fact that the results are so positive is great credit to everybody involved, and Sally in particular for holding it all together. So it's not a question, Chair, it's just a statement, because I think this is a really important report. Thank you very much.
Thank you, Councillor May. I will pass that back to Sally. I know she's very disappointed not to be here, because she was looking forward to presenting the paper.
Councillor Cohen.
Chair, I wouldn't like the officers to think that no councillors are interested in the e-justice plan, and you know, that's not really it.
Sorry, I didn't mean to be rude to councillors, Chair. No, I think in the nature of it normally goes through to full council, and when you've got a full agenda, it's very difficult to have a two-way conversation about it.
Councillor Waite.
Thank you. Thank you for the report. Substantial report. It must have taken a long time to put together, and very good, and obviously very important work. One of my other roles is I'm on the scrutiny panel of the Avon and Somerset Police, and we had a discussion at our last meeting about a very similar sort of area. And my question, because I'm not allowed to have preambles, is the police are having difficulty getting attendance data from academies. I wondered if you had the same problem.
It's just very helpful that Rosemary is here, so I'm going to ask Rosemary to respond to that, if I may.
Hi. Yes, is the answer to your question. We do. We have a system whereby we collect attendance data through our database, through, I can't remember what it's called, recall system that pulls it through from the national. And they should feed into that, and then they feed into our database. But we've been talking a lot to Liquid Logic, who provide our database, because it's not very accurate. They do provide it. It's whether we've got the actual information accurately held in our system, is what I'm trying to say. But it is, yeah, but it is provided by most of the academies, I would say. So, do you know how you've tried to get the data?
Well, I'll possibly answer that in a slightly different way. I mean, essentially the police say that they asked for it, and I think, like you said, they question the legitimacy of some of the responses. And what they said at the meeting was that they felt there was a sort of publicity angle with the data, in the sense that academies obviously are very, I don't know, focused on good exam results, good statistics for Ofsted and that sort of thing.
But they should have full attendance data. What I was going to say was that I oversee the Children Miseducation Service, and they are the team that collect all the data and the attendance data. So I don't know whether they might be able to help.
Okay, I'll take that back.
Okay, thank you.
Owen.
No, groups of schools.
Yeah, whereas...
Absolutely, would agree with that. And yes, we do keep all that data for anybody that's school age, and then Youth Connect would keep it for the ones that are older than school age, because my team are only responsible for statutory school age, so up to 16. But yeah, and I mean, I would think that we could link in with the police somehow and provide them with that data. I would have thought that our data teams could do that. So yeah, they can get in contact with me. Yeah, absolutely.
Can you give me your email address at some point, so I can...
Yeah, I don't know how to, but yes, I will.
I'm sure
I'll send it to you, Mark. You'll pass it on, will you? Mark will pass it to you. There we go. Thank you, Mark.
Thank you. Before we go on, can I just remind members to use their microphones when they're speaking? Because, thank you. Paul.
Thank you, Chair. Can I just ask that the HMI probation inspection is due? Could I ask that we record that we would like to see that inspection when it's done, because I think it would be handy to see that situation. And in particular, I think there's been real issues over the years around the probation service and their engagement with the youth offending service. And I just wonder whether any inspection, does that look at the total picture, or does it look at the youth offending side of it? Because I think we could, in actual fact, get some problems with the probation service affecting our service, where I think, in actual fact, it is a collaborative service.
Yeah, thank you. So we have been, as a YOS Management Board, we have been preparing for an inspection for some time. We have no idea when it will happen, but we did have a YOS Management Development Day in June, and part of that was self-assessing ourselves against those standards. And certainly, as chair of the YOS Management Board, I will present our local presentation to the board. We did have some challenges around probation represented, but we now have a standard lead for probation who has attended the meeting as of last week. So we're pleased that that has been resolved.
So
I'm very happy to share the report whenever.
That self-assessment, could we not as an item on the agenda, but could we see that? Because I think it would be quite handy to see that.
Yeah,
Thank you.
We're very happy to share.
I have got a couple of questions from Kevin Burnett, who wasn't able to attend today. And I don't know if you'll be able to answer them, Mary, or if we need to pass them back to Sally. But anyway, I'll ask them here. So he wants to ask, where in the work plan is the preventative work with schools and the youth forum to address and support vulnerable pupils in terms of attendance, exclusions, SEND and NEET, and what does this work involve? It was referencing something on page 59 of the report. And his second question was, could someone explain more about the Ofsted recommendation return to home interviews?
So I'll take the second one first. So one of the recommendations in the Ofsted inspection and the ILAC inspection that we had in February was that the local authority could have a more strategic analysis around return home interviews following children going missing. So whenever a child goes missing, they need to have a formal interview in terms of what precipitated them going missing and how do we prevent that happening again. And one of the recommendations from Ofsted is we could have a more strategic overview of any patterns or trends around those return home interviews. So we are taking that forward as part of our improvement plan in terms of Ofsted. In terms of the first question, I'm sorry, Michelle, could you repeat the first one?
So he just wanted to ask, where in the work plan is the preventative work with schools and the youth forum to address and support vulnerable pupils, and what does this work involve?
Yeah, so there is another group that Jason Pegg chairs in relation to black families in relation to NEET, and that's the group within which that work would be done in terms of those young people at risk of exclusion or not attending, and Youth Connect are part of that group as well.
Any further questions? Oh, Andy?
I'm very pleased that you've settled into the Keynsham Civic Centre and all the services are at the Keynsham Civic Centre. So my question is, a bit cheeky, would it be better if this meeting was held in the Keynsham Civic Centre?
Did Andy tell you he lives in Keynsham? Okay, thank you, Mary. Thank you. And we've got one more question from Paul.
No, Chair, I think we need to make a recommendation through to the full council that this is a really good report and it should be approved by the full council.
Yep, happy to support that. Yep. Okay, right.
Thank you.
Thank you, Mary.
Happy to travel to Keynsham.
Yeah. I love a day out in Keynsham. Happy. Yeah. Okay, thank you, Mary. So we'll move back to item number 10, which was the Children's Mental Health Transformation Plan. What's your name, sorry?
It's Jane Rowland.
Okay, Jane, thank you. You'd like to make your presentation?
Mark's got some slides which I think he's going to pop up in a moment. Thank you, councillors, for inviting me to be here today. I would first of all like to just express the apologies of my colleagues from Oxford Health who were wanting to be here, but operationally things are extremely tight at the moment across our services, and obviously a lot of them are based in and around Oxford and out into Wiltshire and Swindon, and unfortunately they just couldn't make it today. So I said I'd come and give you a little bit of an update on their behalf. What they would be really keen to do, though, with the permission of this group, is to return to kind of give you a presentation in September. So this will be a sort of preamble to a more full presentation from colleagues with your agreement, but obviously depending on agendas and timescales. So hopefully that will work. In the meantime, to introduce myself, for those of you who I haven't met, I'm Jane Rowland. I'm the Associate Director of Mental Health Transformation for BSW ICS, and I cover both commissioning of adult and children's mental health services. And so today I'm going to give you a little bit of a briefing on where we are in terms of children's services and the work that's underway to hopefully improve our child and adolescent mental health services. It's really nice, I have to say, to have followed Mary and Rosemary in terms of the work that they've been discussing with you, because what we know is there are links between children and young people who have mental health needs and youth offending. So I think it's a really nice, hopefully follow on from the detailed report they've given you. Can you move to the next slide, Mark? Thank you. So this is just really a reminder to colleagues of the BSW model of care for mental health and for health services overall. So it's no different for children and young people as it is for adults. We want care to be personalised. It needs to be provided in the community and helps them live healthier lives. We join up our local teams across the NHS, the third sector and local authorities to support people and young people particularly where they are in their local area. Services that are more specialist,
So thinking about our child and adolescent mental health teams, they provide routine appointments, tests and treatments closer to where children and young people live. And things like hospitals will focus less on routine care and more on that really specialist input that's required. So it's just a reminder to colleagues that that's the espoused model of care for mental health and health provision across our footprint. Go to the next slide. So I wanted to give a bit of an overview of the population, and this is actually quite helpful, Mark, because this shows up better on that screen than it does on my slide, so that's a plus. NHS England do benchmarking exercises every year, and they have recently done and published for us the benchmarking information for child and adolescent mental health services. So I thought it would be helpful to just give you a bit of an overview around where Baines sits comparatively to Swindon and Wiltshire, and also comparatively to our national context. So as you can see, we have a slightly lower proportion of children and young people aged 0 to 18 across the Baines footprint. Swindon, of all the BSW areas, has the highest percentage. And obviously there, Wiltshire somewhere in the middle. But overall, the southwest, which is represented in green, as you can see, reflects that perhaps older age population and a smaller number of children and young people. To move on to the next slide. That being said, we do have a slightly higher proportion of children and young people who have social, emotional and mental health needs. So you can see that we're higher than the national median and the national mean, and certainly quite up there within the southwest overall as well, which is important when we're considering the kinds of services we need to structure in our local communities, and particularly in our Baines footprint. It would be remiss of me not to talk about the impact of COVID on children and young people's mental health. And I think it's worth noting here, this is the national picture around CAMHS referrals per 100,000 of the population. The blue bars show pre-COVID and the red bars show post-COVID. And it just gives you the sense, as you can see, of that rising demand in children and young people's needs. And that's really important when we're considering how we structure services going forward. We cannot underestimate the impact of COVID on our child and adolescent population, and particularly their mental health and also their social health. And I think it's important we acknowledge that. Being out of school, challenges in building relationships with peers, working through being at home. For some children, home is not the place they want to be and not the place they need to be, perhaps. And so there's something about really understanding that COVID has had a profound impact on children and young people. And it's perhaps a different impact from that which it's had on adult services. So there's a really important trend emerging there around demand. Next slide, Mark. So just in terms of the number of referrals and also the acceptance rate, and I think it's important to just, if I describe this a little bit, the number of referrals accepted, the top graph, shows you the total number of referrals that Oxford Health receives and accepts for children and young people, which is hovering just above the 2,500, 3,000 mark there. The acceptance rate is really high. This is positive in as much as what it shows is the referrals that are going into Oxford Health as the CAMHS provider are the right referrals. So we're not seeing a high pushback of referrals that are received by Oxford Health that say, this child doesn't meet the threshold, this child doesn't need CAMHS provision. The number of referrals they are accepting is high, which shows that we're getting the right children and young people referred into services. That's really important, I think, for colleagues to be aware of. Go to the next slide. Also, the other thing to highlight is Oxford Health, the provider for Baines children, performs really well in terms of waiting times. So waiting times for referral to the first routine appointment is low by comparison to peers across the southwest. That's a good news story for us, but we know there's still more that we can do. We do know that children and young people and their families describe waiting for appointments, and there's something for us about focusing on how we can provide access to local services for those young people whilst they are waiting for CAMHS treatment, or indeed making sure they get to CAMHS treatment sooner. So it's just a bit of a context around waiting times. Next, please. I wanted to just provide a little bit of an overview then in summary of the key findings for BSW. And overall, our children and young people tend to be less affected by income deprivation. Their mental health needs are slightly lower than the national average. The national average is the number in brackets beneath. And the number of children in need due to abuse and neglect is also slightly lower than the national average. What we do see, though, is that we are higher than the national average in terms of school pupils with social, emotional or mental health needs, and we are higher than the national average in terms of the number of 16 to 24-year-olds who are not in education, employment or training. And again, it's really interesting, Councillor Curran, to hear your comments about those young people, and also, Mary, the information you've given in terms of youth offending, because actually that's a cohort of young people that we really need to get into services if they require them, and also support them differently in their communities. So just in terms of meeting the challenge of children and young people's mental health and well-being, and I want to really emphasise it isn't just about child and adolescent mental health services. This is about emotional well-being and supporting the well-being of children and young people across our communities. So the first thing is thinking about the needs of those children and young people. The second is responding to our local and national plans around improving standards. So that's improving access rates for children and young people, creating the right service models for children and young people, and particularly 16 to 25-year-olds, and thinking really carefully about eating disorder services, because one of the features of all child and adolescent mental health populations is eating disorders, is often a co-presenting condition alongside their mental health. Responding to that requires quite a complicated web of partners, and our response necessarily builds on the partnerships that we have across our local communities, but also in terms of BAMES working with colleagues in education, working with colleagues in social care, thinking about how do we provide a more intensive joined up response that wraps around the child, the young person, and importantly their family. I've talked already about the impact of COVID. Recovery is going to take some time, and we have to acknowledge that our workforce has been particularly impacted by COVID, and that does have an implication in terms of the numbers of people and staff we have on the ground to see and treat young people. And that's a continuing challenge, as I articulated at the start of the presentation, in terms of operational pressures. So we've got to learn to live with that to an extent, and to consider how that we can build a model that recovers us from COVID and moves forward with the plans that we have. We've got some really good ambitions in terms of what we want to do, and I'm going to touch on those just in a moment, but hopefully that sort of provides a bit of a tessellated view of all of the things we're trying to think about in the work we're doing. I'm going to go to the next slide, Mark. So in terms of our vision for children and young people and the offer we make to them from a mental health point of view, first and foremost, we want to place children, young people and families at the heart. So they are the most important thing to us, and we need to really build on what we're doing. We tailor our version of the nationally recognised I Thrive model, and I'll talk a little bit about that in a moment. We provide evidence-based support and treatment to children and young people. And what I would say is, alongside that, that the support we provide considers both therapeutic care and medical care, because the two things are quite different, and we need to make sure that we're providing access to therapy as much as we're providing access to psychiatry as a provision. Our services will be integrated and flexible, and we're going to make our community services both targeted and specialist. So thinking about how do we bring those specialisms closer to children and young people in their communities. I've touched on partnership working with colleagues in social care, our voluntary sector and our community partners, and thinking really carefully about the no wrong door. And we use the words quite a lot in health, but I think if I was to describe it, it's about children and young people having confidence in accessing one place where they can then be routed to the right service for their needs, rather than people trying to navigate the often very complex web of service provision, particularly in children's services. So thinking about how do we join up our services and provide that single, simple point of access for children and young people. So in terms of what we're working towards, I talked about the I Thrive model. I Thrive is a nationally recognised model that's been developed by the South London, the Maudsley and the Anna Freud Centre. And there are some key principles that underpin all of the elements that you see. So there are the 4 quadrants around getting advice, getting help, getting more help and getting risk support. The principles that underpin all of that is the common language, so not talking about tiers. We've often talked about tiers in children and young people's mental health services, and we need to move away from that as a language. It should be a service where children can access different elements of this I Thrive model as and when they need it, so you don't have to pass through one to get to the next. Needs-led, so I talked about therapeutic care, thinking about how do we really wrap services around the needs of the child and the family. That decisions are taken about children and young people in partnership with those children and young people and their families. And that's about moving away from perhaps what we might describe as quite a paternalistic element of healthcare to something that is much more joined up and designed with the child in mind and the child in the room. Prevention and promotion, so thinking about how do we link with education, school settings, community responders, about how do we work together to promote good mental health and well-being, and what does that look like in our communities. And that's particularly important for us when we reflect back on the number of children and young people who have emotional well-being needs that I shared in one of the earlier graphs. I've talked about partnership working, thinking about outcomes-based models. We're very good in the health service overall about thinking about outputs. We need to move to a model that is outcomes-focused. So what's important for the child and young person? What goals do they want to achieve? What are their ambitions in life? And how can we support them to move forward and to recover so that they can fulfil those ambitions and live well in adulthood? We need to reduce the stigma of mental health, and I think that I would suggest we're seeing a change in narrative in schools, which I think is really positive. Mental health is far higher up the agenda than it's ever been before, and children are more confident, I think, in speaking about their emotional well-being and mental health needs. But there is more to be done, and particularly for children and young people's mental health, and Mary knows I say this a lot, I am absolutely of the view that if we can do more to help children and young people have a positive start in terms of their mental health and well-being, we will absolutely reduce the number of people suffering mental ill health in adulthood. So there's a real commitment from me, but also a responsibility I believe I carry and we carry as partners to really think about that and to reduce that stigma and to encourage children and young people to access services when they need them. And so therefore, as the last point says, thinking about accessibility and timely intervention for children and young people in the community. And that isn't just about NHS provided services, that's also about third sector providers, it's about our community response, it's about working with that wider network of children and young people's organisations that cover our BAMES footprint. I want to move on to the next slide, Mark, thank you. So where we are now, in terms of our community-based support and one-off contact, so in that sort of early help and advice segment, we've got local support offers in place, such as Off the Record for BAMES. We also use Cooth, which is a digital platform that children and young people can access via self-referral. The challenge we have with Cooth is that it's a digital offer. And one of the things we would observe, both in our BSW system, but is comparative with other colleagues across the Southwest, is that we do have we've seen a drop in digital activity. And there is an element of digital fatigue amongst children and young people. Having experienced so much of their education online, they actually want that human contact again. And so we need to be mindful of that in that terms of that early help, that early support offer. We've also got mental health support teams in place across BSW. We've got 2 teams across BAMES, and we want to expand that in line with the national plan that I talked about earlier on. We are seeing increased demand, but also increasing complexity amongst children and young people. And there is something for me about that unlocking from COVID that we need to acknowledge. children and young people's mental health has deteriorated and they are presenting with more complex and complicated needs. So we need to really acknowledge that. We have a local CAMHS liaison team in place at the RUH. It's operating well, but we are seeing increasing demand from children and young people into our acute hospitals. And that's something we really need to reflect on as a system, because we are going to have to look at how we provide innovative models in partnership with our acute trust partners if we're to meet the needs of children and young people where they present. We've launched a new crisis and home treatment service, which launched in November, so we're starting to see some green shoots from that, which is really good. And that crisis and home treatment team is about thinking how we can take intensive support into the home rather than having children in a hospital bed, whether that be an acute hospital bed or whether that be in a mental health hospital. We know, however, from an inpatient point of view, there is a national shortage at the moment of inpatient CAMHS provision. And so, as I said, we need to think creatively about what we're doing to provide more intensive support to children and young people at home, because the beds are not there for us to access at the moment. So we've got to find alternatives as a system. I would say Oxford Health colleagues have been fantastic in terms of really thinking differently, and I commend them in the face of the pandemic for really kind of thinking differently and trying to be as creative as they possibly can. So in terms of our ambitions for the coming year, we're embedding iThrive across the whole system at the moment, mapping out our community assets, linking with education and social care, and supporting children and young people in their communities. We've got a large-scale transformation event taking place on Thursday. It's really exciting. We've got partners from all of our sort of core footprints of Bain, Swindon and Wiltshire coming to that event, and the purpose of that is to really think together about what we can do differently for children and young people. I've mentioned expanding our mental health support teams. We've also put in investment to improve access and waiting times for children and young people to meet those national standards and stretch beyond those. We're also doing some specific work around eating disorders, particularly implementing 3 models, and I've put the kind of the translation of the acronyms because we do talk about them in acronyms and it can be a bit tricky to navigate. One is around a first episode rapid intervention for eating disorders, which is called FREED. What we know around eating disorders, if you can positively intervene in with the illness within the first 3 years of presentation, you are likely to recover that child. If you delay it beyond that 3-year period, it's very difficult because the behaviours become much more hardwired into the brain, and it can be very difficult then to move the young person away from an eating disorder and into recovery. We're also implementing some new approaches around avoidant restrictive food intake disorder. What we see is ARFID is a feature of often children who have autistic spectrum disorders, but it can be a feature of all children and young people presenting with mental health needs. And it's not so much about having an established diagnosable eating disorder, it's more about being very specific about the food that the child would consume. So it is those children and young people who will say, I only will consume orange food, or I would only, they will be very, very specific in what they will consume. And then the final thing is around Alpine. I talked earlier about presentations in acute hospitals. Alpine is around thinking creatively with our acute trust partners about how we can support children with eating disorders in the acute hospital setting. And that's a 3-week programme of intensive physical and mental health treatment that rapidly seeks to reset the child and build healthier eating habits moving forward that then the community teams take over when they're returned home. The benefit of an Alpine model is it provides respite for the family as much as it does for the child, so that reset is a whole family reset in terms of approach to food, approach to eating, approach to meal times. And it's had some really good outcomes, so we're trying to push that through across our 3 acute hospitals. We've piloted it in Salisbury with success, and we're now hoping to roll that out this year to the RUH and Great Western hospitals. I mentioned earlier on about 16 to 25s. 16 to 25s are an important group of individuals for us because what we know is they are often still in that space of wanting and needing the intensive support that child and adolescent mental health services can provide, but they're all also counted as an adult in health terms. And bridging that gap is a really important feature. So the work we're doing is around how do we effectively move children and young people at the age of 16, how do we transition them into adult services, but in a much more supported long-term way? Because what we would reflect is that children and young people have often described 18 as being like a cliff edge. They fall off the service that they were in that's held them for such a long period of time, and they're suddenly in adult services. They don't have the language to navigate it. They don't know what services exist. They really struggle at that point. The other thing in BAMES that's particularly important for this population is around our university students, because what we often see as well is children and young people who come to Bath for university education and who have experienced a mental health need in their home setting, and they arrive here in Bath and they don't know how to get into services. So we're building really close links with the university to support those children and young people through working with the university services, through their health provision, and working with the mental health teams. And a lot of that is hopefully led by our third sector. Colleagues may have heard us speak or heard colleagues speak about the Provider Collaborative. The Provider Collaborative is made up of those organisations who provide inpatient services for children and young people, of which Oxford Health is one. And one of the pieces of work we're doing with them this year is around implementing a hospital at home service. So when I talked about that intensive home treatment that goes in, it's providing the features of what a child would receive in hospital, but in the home setting, with associated support for the family. And then the final element is around thinking about children and young people with neurodevelopmental disorders. And I think it's quite often we confuse child and adolescent mental health with child and adolescent neurodevelopmental disorders. They're the children and young people who have autistic spectrum disorders, who may have ADHD, who may experience all of the challenges that those conditions bring, but they also often have a co-presenting mental health need. So led by the Clinical Director for Children's Services, Vicky Lakanen, she started doing work regularly, so she has a regular call now between community paediatricians who predominantly support children and young people with those neurodevelopmental disorders and the child and adolescent mental health teams. So genuinely providing that joined up approach to care, thinking about specific cases, planning together about what treatment looks like, and working with the children and young people and families to make sure that it's a holistic offer that considers both the neurodevelopmental and the mental health need. So that's a bit of a whistle-stop tour, and I appreciate I've bombarded you with a lot of information. It's a preamble for September, so I'm happy to take questions. I am by no means the expert clinically or operationally in this space, but if I can't answer, I'll be honest and I'll direct your queries to colleagues and hopefully get back to you with a response. So thank you very much.
Thank you, Jane. Thank you for your very comprehensive presentation. I've got a question first from Paul and then from Liz.
Can I just say, for somebody who is not the expert, you've done a brilliant presentation. I'm involved with BNSSG, and I see the problems there around, particularly the complexity and the volume that is increasing, and then the problem follows on, have you got the resources to deal with it? So I think Oxford Health have obviously been doing a really brilliant job. But when when young people move into adulthood, they then come under AWP. And then when you look at the comparative figures for AWP, there's a big gap. So is there an issue there? Because I keep on, and Mary will know about the transition, because the condition SEMH, does that appear? It doesn't appear in adult circumstances. So, you know, all of a sudden there's that gap. And you've mentioned about the 16 to 25, but I think it's a real issue. And I think I feel really proud of the fact that you are there and that you are actually thinking and working with local authorities and the health providers in a way which I think is, I think that's a stunning presentation. So thank you very much. And I've probably got one or two more questions, but I'll behave, Chair.
So just in response to the piece around how do the two systems, or how do Oxford Health and, I've got my mic on, haven't I? Yeah. How do Oxford Health and AWP work together? I talked about that 16 to 25 group. one of the things that's really positive about it is it's a jointly led group between Oxford Health and AWP. So the professionals involved in delivering CAM services and those involved in delivering adult services are absolutely working together to think about how the pathway for that cohort of children and young people entering adulthood can best be met and where it is best met. And some of that is with features of a child and adolescent mental health service. So thinking about family therapy, for example, is a good example where that could extend beyond that 16 into 16, 17, 18. And then thinking also about how we loop children and young people into adult services more quickly so that they understand what's gone before and what follows. So it's about that information around the child and the young person and what their conditions have been during childhood and how that flows through then into adulthood. The other people who are closely involved in that are our third sector partners and also primary care, because I didn't acknowledge, and I should have done, that primary care has a real role to play here, because oftentimes the place where young people present is to their GP, or families present is to their GP. And Dr. Sarah Blakely, who is the mental health GP lead for our footprint, has been incredibly passionate in terms of championing what can we do differently to support primary care so that we provide that early access, early support, early direction to the right service.
I just ask, a follow-up. The trouble is that the GP service is not 7 days a week, 24 hours. And mental health problems don't exist, within those working hours. So I think there's still that gap there. But I do think I Thrive is brilliant and it is the way forward. Does that then apply, because last meeting we had about the adult services, I'm not quite certain how that works in terms of adult services.
So it's interesting, adult services doesn't have the same standards that wrap around it, but I alluded earlier on to the need to think about therapeutic care rather than diagnostic-led care, so thinking about a needs-led approach rather than a diagnosis-led approach. And what I can say is that in adult services, which essentially is what the I Thrive model is about a needs-led approach to looking after somebody rather than a diagnosis-led approach. And what I can say in adult services is they're absolutely thinking about how do we shift away from using diagnostic labels quite so much, and how do we think about what the needs of the individual are, and particularly that therapeutic intervention earlier on, so that psychology input quicker and sooner.
Thank you. Councillor Hartman.
Like everyone else, thank you very much for a very comprehensive report. I'm really interested in one of our main problems in mental health, which is eating disorders. And what I was thinking about is how quickly do you go from being, what's the threshold rather, for getting a referral? And some residents have contacted me to say that you really have to be at death's door almost to actually get a referral. And I noticed that then the waiting time for an appointment is about 6 weeks for Baines, which is good-ish. So therefore, I was very pleased to see that this is happening, or is it happening, is my question, the first episode rapid intervention for eating disorders, because by the time they get to that referral, the threshold is so high that the damage is done. It's very, very, very difficult to try and resolve the situation. And my second question is, if this is okay, Chair, is how involved are your mental health teams with schools? Thank you. You mentioned universities, so I thought I'd ask about
that's
schools.
very helpful. So I'll take the first one first. The Freed model we've invested in as a system this year, so we've put money in to support rolling that out across our communities. It does require some workforce, so I would be remiss in not saying there is a workforce challenge in child and adolescent mental health services. But what I can say is we've got a really good service in terms of Oxford Health, so there's something, isn't there, about the attractiveness of the employer as much as there is about the kind of service that you're providing, and I think we've got some good evidence of that and people wanting to kind of come and work for Oxford Health and work in this footprint. So we have absolutely invested in that, and I acknowledge what you're saying. We need to get to children and young people sooner and quicker to be able to hopefully support them beyond an eating disorder, and they can recover and, as I say, move on in life. So that absolutely is happening. I can talk to operational colleagues about how they manage the thresholds and give you some feedback on that, because there always have to be certain criteria. What I can say, though, is also our third sector partners are supporting some of the work around eating disorders and thinking about what we do, because also there's a point about accessing local help and local support and making that clear to children and young people and their families that there are places they can go if they're concerned, and also sharing that information with primary care, because often it's GPs that start to notice some of those trends in reduction in weight, avoidance of food, those sorts of things that start to push towards that eating disorder. So thinking about some of that early response from those communities. The second thing about schools, I talked about, we have the mental health support teams, which are a nationally mandated model that we've got 2 in Baines. We'd like to have more. We had a really great meeting. One of the things that we had a really successful meeting this week, and I think, Rosemary, Olwyn Donnelly might be in your team, with Olwyn Donnelly, who works with our education services, and we were talking about if there's an opportunity to put in place some specific lower level mental health support or mental health and wellbeing workers to work particularly with those children and young people who are at risk of being referred to the home education referral service, because that's a cohort of children and young people that once they're out of education, we've seen the impact from COVID on children and young people's mental health when they're not in school. And so there's something about how we do some positive work around mental health and well-being at that point, and we intervene at the point the child is out of school for a period of time. And I'm not talking about the children who are out for 6, 12, 18 months. These are the children who are at risk of tipping into that, and doing some earlier intervention. So that's a very early germ of an idea, but definitely working with Rosemary and her team, particularly for the Baines community, which I think will be really positive if we can get that off the ground. And I'm certainly quite excited by that, because I think it's absolutely something we need to do more of. Thank you.
Before I take the next question, I'd just like to say, as a parent who's had experience of this, I'm delighted to hear that. Thank you. Councillor Cohen.
Thank you, Chair, for your report. You mentioned about children co-presenting with neurodevelopmental health issues and pediatrician and children with autism and ADHD, and often children with learning disabilities. It is often the social workers in the say the children's team that schools and families turn to in terms of when there are concerns around the mental health of a young person, a child who has a recognised learning disability, and that needs to be a strong relationship between the social worker very much at the sharp end of all of that. And then also, I was just going to ask, in terms of how the children are treated, is there any statistics kept on children who are being helped by different therapies and children who are being medicated?
I'd need to check around the statistics around therapy and medication, so I can go back and find out about that. No, that's very helpful to ask. The second thing, just in terms of the joining up and social work being involved, I think you're right, we've started small probably in terms of that network with community paediatrics and community psychiatrists, community children's psychiatrists. But as we develop that, I think we probably do need to think about how we bring in social work and how we start to develop that across our communities, and importantly how we link back to schools, because a lot of children are supported in school, and something about how we link and join up with the education healthcare package children and how we kind of work with all of those communities. I think that it's one of the things that we definitely see as something we need to do more work on. Whether we can achieve all of those things this year, I'm not sure, but certainly it's not something that people are ignoring and kind of pigeonholing into certain areas. We're definitely joining up that work around the community.
Got a question now from Andy and then Paul, and then I'll move on to the next item. So Andy, please.
Okay, thank you. Actually, You made the mistake of giving you a lot of statistics in your in your report. So I've got a couple of statistical questions for you. On your first chart, you pointed out that the number of young people in Baines was less than the median. And on the second one, you pointed out that the percentage of young people who are looking for social and emotional and mental needs was above the median. So do we imply from that that this is an area where mental health services are in greater demand than elsewhere in the country? That's my first question. My second question is to do with your, and also with the first question, I wouldn't mind, if you'd like to hazard a guess as to why that is the case. Now I've confirmed that it is, because that's quite an interesting issue there, that perhaps mental health services in this part, mental health needs in this part of the country are greater than in other parts of the country. So the second one is, I love your vision and I love your report, and you said on your fourth, on my diagram it's blue, on the screen it was sort of grey, evidence-based support treatment available close to home in community settings, which is a lovely phrase, and I think everybody in this room would support that. My question is about the evidence. So how do you collect the evidence, and is the evidence generally qualitative or quantitative?
So, on the first question around emotional and mental health needs, yes, I would suggest we could infer from that the need is still high. So just because you've got a lower population doesn't mean that the need is lower. The need is still high across Baines. What I guess I would say is we need to be cautious about this statistic in the sense that it covers social, emotional and mental health needs. So it is the broadest breadth that you have. It isn't just purely about, I suppose, a diagnosable mental health need. It's much bigger than that. So to get under the skin of that, we probably need to ask some questions about whether there is something around children and young people being well informed in this area, so they therefore identify as having a need themselves, which maybe other children wouldn't in other areas, as much as are there more children who do have those needs. Do you see what I'm saying? So it may be there's a hidden population. We could probably dig underneath it a bit, and I can talk to the benchmarking network about how they derive that information. It's Public Health England held information, so it's information that's gathered through the fingertips data that you probably all see it periodically through Health and Scrutiny, and get information around that. Your second question around evidence-based. So I've talked about the I Thrive model. I've talked about things like Freed and Alpine and ARFID. All of those are evidence-based models that are developed by other parts. They'll be developed usually nationally. They get developed by other systems. We may develop some of them too, and they build that evidence base around children and young people. But it's both quantitative and qualitative in terms of how they derive those models. So some of it is around the National Institute for Clinical Excellence, which will be that's the sort of, if you like, the national standards that we have to meet. So that's the national evidence base as endorsed by NHS England and the Department of Health and Social Care. There's also then the wider evidence base around new models that are developed by partners that demonstrate significant or improvement in outcomes for children and young people, like Freed, like Alpine, like ARFID. So I suppose I would say it's not just qualitative and it's not just quantitative. There's a whole blend of things that go together in creating that evidence base. And what we're trying to do is to learn from other organisations nationally and locally in terms of what works well for children and young people, but also to ask children and young people what works well for them. So there's something as well about that continuous feedback and using that as part of our evidence base, that we know that for children and families, X or Y has particularly good outcomes, so we need to replicate that and extend that further.
The national data, is that generally quantitative?
In terms of the data that gets shared, the bar charts and things like that I've shared, yes, it's generally quantitative. And then the NHS, the benchmarking network, I have to say, is enormously helpful, and they give us a huge amount of information that they capture, and it allows us just to see our position relative to others. They also provide support to us along the way, so we can say, well, quantitatively, who are the best performers? Can we go and connect with them to understand what they're doing that allows us to learn and to develop our services? So we do quite a lot of that, but it's generally quantitative, but gathered from a range of sources.
Councillor May.
I wanted to just perhaps put a different spin to the point Andy's made. If you look at the numbers of young people and you widen it out beyond Baines into the southwest, quite clearly the numbers go up significantly around the percentage of pupils from the lower areas. But the one that sticks out in your mind is the question around Wiltshire, which is about average, but then below average when it comes to those referrals. So I think there's something that we can learn as an integrated care board about looking at the overall picture within our area to see how we can develop. I would just add that it would be quite handy for us to see the Bristol statistics on this, because some of us have got communities that are adjacent to Bristol, and some of those GPs refer young people to the Bristol area. So I think there's some issues that I wouldn't mind at some stage when you come back, perhaps picking up the wider Bristol dimension. But the other question I really wanted to ask was, at the moment there's a local plan partial update that's taking place downstairs somewhere, and we're about to do a new local plan serving the whole of the Bath and North East Somerset area, and that's going to be driven by new housing, and new housing tends to create people, and people create. So do you get involved actually in the planning of services around those additional houses coming into a community?
Yes, in so much as we do contribute and support the development of the Joint Strategic Needs Assessment and that forward look for children and young people. And so I recall it's a feature, it's a specific chapter in the JSNA, which is good. So that allows us to have that opportunity to contribute and to consider what that looks like. The other thing is when we think about things like the Community Infrastructure Levy and the kind of work that goes on around that, we have opportunity, and Baines is very good at asking for contributions for us for those sort of wider council-driven initiatives around what do we do to address the needs that may present as a result of that increase in population. I would also say that at the moment we are just about to start refreshing our mental health strategy for the BSW system, and the children and young people's element will absolutely be a feature of that strategy. So I alluded to the workshop that's happening on Thursday. That's a starting point for us to consider not only what are we going to do this year and what are the priorities and how do we push forward with those for this year and next year, but to take that longer term view of what do we think our population will need in the future, and how do we, if you like, front end our support into those early access points, those things that we know need to happen in communities, so that hopefully we mitigate increasing demand for children and young people's specialist mental health provision. Thank you.
Thank you very much, Jane.
Thank you all. It's been lovely to see you all again, and I will make sure colleagues come back with response to some of your questions as well at the meeting in September. So thank you very much.
And we will do what we can to fit you in for future update, because it'd be great to hear an update on what's happening.
Thank you very much.
Mary, before,
Yeah, could I just add just two further points? There was reference to the Joint Strategic Needs Assessment, and certainly there's been a significant focus on children and young people's mental health within that. And also what we used to call the Schools Health Survey. So that's the Children and Young People's Health and Wellbeing Survey, is currently underway across all of our schools. 100% of secondaries have completed it, and 74% of primaries. So we'll have all of those results by September, and again, those will feed into the mental health strategy. And just for colleagues' information, I sit on the Children and Young People's Transformation Board across BSW, and again, children's mental health is a key priority. So there's a real strong linkage between what our local evidence base is telling us with the developments across BSW. Thank you.
Thank you, Mary. Okay, so that's the end of item 10. We're now going to jump to item 8, which is our Cabinet Member update. So I'd like to hand over to Councillor Dina Romero.
Thank you very much, Chair, and thank you for your patience. And I'm sorry that I was somewhat late, but I had to represent the Cabinet at the Queen's Baton relay as it was coming through the city, and it. Some parts of it were possibly not as fast as you might have hoped. And I did say, you've got to speed up, I've got to go to PDS. So thank you very much. I'd just also like to introduce Marie, who is here on work experience. So she's had quite an exciting day so far, so I hope you don't let things down. So yes, you'll have received my report. I know that I've had some questions from Liz and from Kevin, yes. Yes, and I was just slightly surprised to not see Kevin, and obviously those questions will, be being answered too. So I'm very happy to answer other questions and let you know anything else that you're interested in.
Dina, did you just say you've answered the question, or are you about to answer?
I said that I was going to answer the question, but there are some of the questions I think you had that others were answering. Sorry, I was slightly confusing myself there with my...
Yeah. Yes. I'm glad to see you had the right footwear on for the Baton episode, and I assume you weren't involved, were you?
Well, I'd had to do some running just so that we could be at the beginning and at the end.
Right, so you are going to answer my question at some stage.
I will answer your questions, but do you want to remind me what your question was, Liz? And then I will...
Okay,
lovely. Thank you. That saves me searching for it.
Yeah. Obviously, special education needs and disabilities, the cases have been rising by 25% nationally, and I've been involved with quite a few of my residents in various cases where there were no places for our children with special educational needs. And I really wanted to ask you, what are we doing about increasing our capacity? Because obviously I think it's becoming very clear there is a great problem. Our schools, our special needs schools are full up. And there's the old chestnut of taking special needs children from over the border when from places like Somerset, etc. When should we just be looking after our own special needs children in Baines? Now, I think there is an answer to that, but I'd like you to say it for me.
Thank you, Liz. And as you know, that there is capacity being kind of built in, and I'm very happy to pass on to Mary just to give you a bit more detail of exactly how that is being provided. I mean, I'm sure you're aware that for example, AP, we're looking to consolidate that on one single site, and there's some feasibility work coming forward on that, and we're also looking at residential provision. Alternative provision, so it's for children, I'm sure you know, it's for children who may, for a number of reasons, not be able to be in school for a certain period of time, or maybe for the rest of their education. So it's another way of providing them with the education that they receive. I probably have explained that incredibly badly, and I'm fairly sure Mary's going to correct me quite a lot in a minute. Are you doing it right now, Mary? If I may, I'm going to invite Rosemary to provide a response to the question.
Rosemary,
Thank you.
I should have actually passed it to you, shouldn't I?
Rosemary's attended for Chris today, so Rosemary will respond to the question. Thank you. Collard. Rosemary Collard.
Hi, I did actually respond to your question in writing, but I don't know whether you've received that. I did. I can read it out though. That's fine.
Yes, please, would you? Because I think there's must be a delay.
So, we do recognise that there is an issue in Baines with sufficiency of places. So actually, interestingly, I'm just about to change my job from being head of service to I've got a title, but I can't remember what it's going to be, in September, where I'm going to be concentrating on that piece of work as a project work. And I've got two main strands to that. The first one is that I'm hoping to open some more resource bases attached to mainstream schools. I'm hoping to open between 5 and 7, and that's using the DFE grant funding money that we've received to either use existing empty classrooms in schools and adapting them, or possibly new builds. I've started that piece of work with the CEOs of the MATs. I've asked for visions of what they would like to open, and then I'm holding a meeting with them and some parents to have a look at what they're offering, and then we'll take that forward, hopefully based on where we decide to go, and using the data about where these. I've got masses of data about where the children are and their needs. Our highest need is still ASD, closely followed by SEMH, so that's what we're looking at. And then the other strand is that the DFE have just opened a wave to enable us to bid for a new special school. So I have put in an expression of interest for that, in the hopes that we will then have to put in a full bid by October. And we're looking at a 120 place generic special school within Baines. So that's very early days yet, but we are going to start building the evidence on that. I've also met with Bristol and South Gloss so that we all know what we're doing and supporting each other with the special school bids. Bristol are putting in 2. I don't think South Gloss are going to put in 1, so that's quite interesting. I did send you asked about Baines children in our special schools. Our special schools are full. We've got 3, as I'm sure you're aware. And it's a very difficult thing to do because legally, in the SEN world, we can't refuse to take a consult from anywhere. So the schools have to consider them and then provide a legal response to those consults. However, I did provide some data in the fact that Aspire, which is our SEMH school in Bath, in June, I've got very up-to-date figures for this one, that 92% of the pupils are Baines in that school. In 3 ways, I've got last year's figures, I haven't updated them yet. 84% were Baines, and in Fossway, 88% were Baines. So they are predominantly taking Baines pupils, and they do try to do what they can, because they know how desperate it is. But I mean, they're full at the moment, so they're not taking any. But yes, it's not really a case that we've got a lot of children in our special schools from. And obviously, the other thing that's happens is that we place in other local authority special schools, so they might be placing in ours, but we place in theirs as well. So it's yeah. Does that answer your question?
Can I just ask Rosemary just to add a little bit more, because the green paper on SEND may change things as well, because what government appears to be looking to do is to reduce the numbers of VHCPs as well, and obviously that may well have an impact too, and it'd just be useful for perhaps to get a view on that.
So the other thing about the SEM green paper, which I think I put in my answer, which I didn't really say to you, is that they have it does say that the DFE are committed to opening 60 new special schools in this wave, so fingers crossed. Yeah, so the SEN Green Paper has a big emphasis on SEN support, so that's what happens before you get to the point of needing an education, health and care plan, and Baines have got a graduated approach tool which we've used, but we are hoping, well, intending, not hoping, to roll out more around that. So we're going to work with the MATs and the schools to look at where that's embedded successfully and where they need support, and put in the support to help them embed that. It was rolled out just before COVID, and so that's not helped, I would say. And then also we are looking at what else we can do, put in some support services and make sure schools are aware of the support services that are out there as well, to put a bigger emphasis on the support that goes into the school while the children are on SEN support, in the hopes that we can reduce plans, but hopefully that we can make lives better for those children, that they don't get to the stage of needing one. Does that answer the question, Dee?
I've got a question from Councillor Curran. Sorry, Councillor Curran, please, can you use your microphone?
It's good news to hear that there's the possibility of a new special school, and I wondered, had there been any thought given as to where that might be, given that we have a school in Radstock, we have one in Bath, would Keynsham be the obvious location?
Yeah, so we haven't been able to identify any site yet. I have got an email I've got to send to our planning people, which I haven't managed to do yet, to see if they can identify anything. I have had a meeting with a couple of people, but no luck so far. But yes, Keynsham and Chew is the obvious, and Keynsham would probably be the most obvious, but that side of Bath or out towards that side. Because as you say, we've got Three Ways and Aspire in Bath, and we've got Fossway and Norton Radstock, so it does make absolute sense to be looking at that side, and that's where I'm looking.
Good luck with that. I still have the mental and emotional scars of trying to build schools in Baines, but there you go.
Thank you.
Do we have any further questions? Councillor Waite.
It's all learning in Keynsham, clearly. I have to say, I'm very impressed, Dina, that you actually managed to outrun the baton relay. That is quite an achievement. You know, I don't think we should go. That should not go unnoticed.
I'm fitter than I look.
Okay, my question's about the St John's primary empowerment programme. Now, I don't. You possibly made a mistake of giving us links from your report into other reports. So I was very interested in that. I couldn't, for the life of me, understand what primary empowerment would look like if we'd actually been successful in achieving it. So I wouldn't mind somebody telling me what that is. I mean, I know what the words mean, but I don't know what it is in practice. And I've got another question as well, along the same lines. In the report, it talks about a safe place away from school, which, in fact, I'm a mathematician, I'm not an English teacher. The phrase they use is a safe place out of school, which I'm not sure that's very good English. Anyway, so how does a primary school child have a safe place out of school, which presumably is not the home? So that was my second question.
Well, I'm very glad that it's not a stats-based question or questions. I'm going to ask Mary to come speak up about the first and maybe the second too. And I don't know whether or not you've already had St John's come in at any point to talk about their work, but it might be something to consider on your plan.
So certainly I can respond in terms of the primary empowerment programme. So what that programme is doing is working with 7 primary schools where the attainment gap has been lower than some of the comparators. And some of the tools they're using, it also includes a speech and language therapist to help with language development. So it is very much around language development and readiness for learning. That's probably
Okay,
as much
that's okay. Yeah.
Is that sufficient?
Yeah.
And then in terms of your second question, which did that refer to, please, Councillor Witt?
It's the same. It's the same report, and it's quite early on in the report. There are 4 bullet points, and they said the area that identified are nutritious food every day, which is very good. A safe place outside school, which is my question, and then there's professional behaviour and emotional support and additional support for funding, reading, writing, oracy and maths. And I just was a bit bewildered as to what a safe place outside school is.
Well, and you're correct in your assertion, because the safe place would be home, would be the family, but I'm not sure in this context. Oh, thank you.
Chair, so sometimes where a young person or a child is perhaps having difficulties at school or having difficulties accessing school, voluntary sector organisations are sometimes commissioned to provide support for that child or young person, and that often takes place in community centres or health centres or other places, or just it can be outdoors in parks and things like that, but it is support for that young person who maybe needs that sort of what's seen as a safe space outside of school, which is not home, but as home would normally be just a safe place, which is correct.
Facilitate the concept of an outside safe space.
I'm not familiar with St John's, but
Okay.
It's been a sort of a way of working that's existed for quite some considerable time. I'm not entirely certain how St John's arranges this, but they have been given sort of like the tools to do so. So I think it would be really helpful for you to hear, perhaps straight from the horse's mouth, as it were.
Okay, I think now we've got a question from Chris.
Is it, I've got two things. No, I've now forgotten what I've... Oh, yeah. Going back to St John's, do you think we could put that on the work plan? Because I'd like to have had that explained to us long ago, but of course we were not able to, basically. And the other thing is, can we have an update on the Culverhay site, please?
I'm always very happy to do so. I just need to have a quick check on what I'm allowed to say and what I'm not allowed to say, so one moment. No, I just don't... I'm just aware that this is being... this could be being looked at globally, couldn't it, really? Yeah. Yes. Yeah. So there's, as you will be aware, there's several projects that are sort of on-site or looking to be on-site on the Culverhay site. The first that I alluded to before, which is the AP, which currently we have the secondary provision on site, and then that's right, isn't it? Yes, and the primary is over in Broadlands, Keynsham again, and what we're looking to do is to bring those two onto one single site. So that will be part of what's being looked at there, and I'll ask Rosemary to speak a bit more about the bid and how that's coming together to provide that there. But the main part of the building, the old Culverhay, what was after that BCA, and if we want to go back, it's probably, what was it, West Hill? That before that. That is, so we've been doing a piece of work with Bath College about providing vocational education on that site for 14-year-olds upwards, and that plan obviously has been a little bit delayed because of COVID and perhaps the ramifications as well around the B words that perhaps I shouldn't say in this room, but the other but where we are at the moment is we are still pushing for that. We believe that the college are looking to have some courses running on that site within the next few months. So actually, it all sounds very, very positive. So just keep your fingers crossed, please.
Okay, thank you very much. Paul, you didn't let me down.
Do you want me to explain a little bit
yes,
about
please,
the
Rosemary,
AP?
thank you.
Sorry, didn't mean to jump in though. So I explained earlier that we are going to put in a bid from the local authority for a special school. Also, there's waivers open to put in a bid for AP provision, but conversely, we can't put in the bid for that. That has to come from a multi-academy trust. So Olwyn, who the other lady referred to earlier, who is actually the Education Commissioner, is going to work with the Multi-Academy Trust to put in a bid for a alternative provision all through school on the Culverhay site, but it has to be done with the trusts. It can't be done directly from the local authority. So I don't know if that helps.
Can I ask which trust?
Well, we don't know yet. We're right at the beginning of starting to work with the trust to see whether any of them are interested. So there isn't a trust that's actually a forerunner at the moment.
And presumably, Dina, you'll give us updates sort of as and when things happen in your...
Of course I will.
Thank
yes.
you. Paul.
Thank you, Chair. On the alternative provision, if you put children and older children together, does that cause issues with regards to Ofsted? Because there's been issues in the past about Ofsted approval of the providers, and if it goes to a multi-academy trust, does that then make that even more complicated? Also, I'm looking over your shoulder, Dina, rather than to you, sorry.
Well, as I'm not required to answer that question, and I will pass straight to Rosemary.
You can answer it, Dina, I don't mind. The two sites are very split on Culverhay, is what I would say. So the Bath College one is, I don't know if you know the site, but it's right at the top where the main school is. The idea of the AP school is right down the bottom of the site, and it would be completely fenced off, have its separate entrance, which you can do round the back. There is a separate entrance to that part of the site, so it would be completely separate.
No, sorry, I was well aware of that because I'm on the working party with Dina. No, it's about putting adults and children, sorry, not adults and children, secondary and primary school children in one provision, because it's always been separated.
With the AP school?
On the AP site, yes.
Well, it would be just an all-through school, just like our special schools are, so there isn't a problem with that. No, our special schools they go from 2 to 19. They don't actually take them as long as young as 2, but yeah, there's Ofsted all the way through. It will only go up to, as far as I'm aware, although I'm not 100% on this one, it would only go up to year 11. I don't know that we're looking at, it's statutory school age, it's not sixth form.
So can I come back to my main question, Chair? Sorry. I think it's a really good report. Thank you, Dina. It's wide-ranging and very much really helpful to me as a backbench councillor. Can I just ask around your first part about the exam results and schools and the report that we were asking for to come back here, and you're now saying March 2023. I know that there's technicalities around pupils, challenging results and things like that, but could we not actually have a report that you put that little rider on that this may change by March 2023? Because one of the key issues is with so many of our schools being given away to multi-academy trusts, one of the key issues is still about those education results that we were getting, and it strikes me that 2023 is too far away, and whether we could in actual fact get a provisional report earlier than that to this committee, because we did ask for that in the minutes last time. And following on from that, the detailed work, the whole area approach, which is picking up the difference in educational results from disadvantaged communities. Unfortunately, in the Baines iPad, the blue bit goes across, and I've missed the bit in the middle. So I wouldn't mind just a little bit more information from you on that one as well, please.
So coming back to the last bit first, I think I'm just going to ask if in future we could actually maybe send it out without the blue tick, because it does seem to be quite problematic, as we, mostly all rely on our iPads, don't we? And then with regards to the first question about whether it's possible, it sounds like it ought to be possible, and I'm just going to check with Mary if it is actually possible.
I mean, we certainly could look to take an earlier report, but the results they're not validated until March 2023.
No, I understand that, but we do pick up from schools, because the other thing is we've made mention in the past about the School Standards Board. We don't ever get a report back here about what's happening at the School Standards Board, and on the whole area approach, I think in the past when we've tried to do this, we haven't had support from all the schools on the whole area approach. So it's really picking up, making sure that we are making real progress on that, because I think it's very easy for some schools to say, well, we're all right, and they aren't necessarily, because the major disadvantaged groups come into certain schools, but the other schools also have disadvantaged pupils as well, and I think sometimes they get forgotten and on the way in the general figures that are presented.
Certainly there's a very strong commitment from the School Standards Board to the whole area approach. Unfortunately, the meeting had to be, the School Standards Board that was due to happen in June ahead of today had to be postponed because of attendance. So the next School Standards Board is the 19th of July, but very happy to take to the School Standards Board about getting an update report from the School Standards Board. And I believe it is on the forward agenda for November. Yeah, I believe there's a real focus on area-wide and the School Standards Board for November, but happy to take that back, and certainly happy to take back to Chris as well. Could we get an earlier indication around what the results are indicating for our local children? Thank you.
can't see any further questions, so thank you, Dina. Thank you, Mary and Rosemary, also for your interventions. So we can move on now to the work plan for the panel. So we did have quite a few items that we added last time. I don't know if anybody has got anything else they would like to add to the work plan. But we've got aside from what we've mentioned already today. So anyone wants to add? Excellent. No, yes. So I've picked up. We've got to invite St John's here to talk about their primary empowerment scheme, looking at having an earlier update on results from schools, and having an update from the School Standards Board. I've got that. And was there anything else aside from those that we'd like to add? No. Dina?
I know I'm not on the panel, but I just thought you might be interested. So in the Health and Wellbeing Board, we've been looking very, with actual real seriousness at addressing inequality, and it seems to me that's clearly an issue that underpins a lot of the questions that you've been asking, certainly in the bit of the meeting that I've been able to be here at. So I just wondered, and it wouldn't be, I don't think, ready for September, but perhaps, between now and Christmas, is that something you might like to have some update on?
Yeah, yes, please. Okay, right, so I don't think we've got any further business, and here we are, finished again at 11:50. Can go and watch the cricket now, thank you.